I want to pass the baton to Bob Cook-Deegan, who's going to take us a bit deeper into some of the medical issues and the health issues. And I'm going to need to continue to share this, Cindy, because this is the slide for Bob. Bob, can you unmute yourself?
I have. Can you
Excellent.
hear me
now? Oops, wait, let me go back to where I was. Yes. Okay, so Bob, as you begin, can you tell us a little bit about your background and why you've gotten interested in COVID?
Yeah, so I'm a physician who teaches science and technology policy and have for a long, long time. I spent, straight out of medical school, I came, did part of my residency, and then I came to Washington and worked at this mysterious place, the same place you did, the Office of Technology Assessment, which is a think tank for the US Congress. And our job there was to channel information about science, technology, engineering, medicine, and other technical matters into a political process and keep our credibility high on both sides of that equation. And turned out it's the first time I ever loved my job. And I stayed in Washington for 20 years, and then I became an academic. And mainly I've studied intellectual property and genomics and data flow in technical systems. Particularly, I chronicled the early history of the Human Genome Project. When COVID came around, geez, it's hard to believe that it was only 9 months ago, because it seems like it was ancient history now. But when it came around, of course, it consumed all of our lives. And just to map it to this idea of public interest technology, let's take each of those words. Is it public? Yeah, it affects everybody. Do we have an interest in it? Yeah, big time. The stakes are really high. It's life and death. 200,000 Americans dead, more than 6 million people on the planet infected. And what's technology got to do with it? Well, it's the only way out of this crisis. So there are about as many bugs in our planet as there are stars in the universe. And it turns out that some of those bugs figured out, well, they didn't figure anything out. They just happened to configure themselves so they reproduce in human hosts, and they don't care where they are. They don't care anything about it. They're little pieces of DNA that spread. And it turned out that they could be communicated from person to person. And when that happens, and it has happened historically over and over and over in history, there are periods in European history when a third to half the population died because of a plague. And a century ago, this book, I don't know if you can switch over to, I guess nobody's watching me. I think they're just watching your screen, Elisa.
But no, we can see you, Bob. We can see you, Bob.
Oh, can you? Can you see the book? Oh, okay.
That's it.
So
beautiful.
This book is the book that our president, then George W. Bush, read when he was president and said, you know, this is going to happen again, so we better do something about it. Let's be ready. And frankly, when a new infectious agent that is highly contagious hits a human population, the only way to effectively manage it is to be ready for it, because otherwise you're catching up. And so, golly, we did, you know. The president sent down the commands, and in fact, our government began to make plans, what could happen, develop strategic policies and technology approaches for developing vaccines and tests and protective equipment. And that carried over actually into the Obama administration. And then, like human beings do, we kind of forgot about it. And at the state level and local government level, public health has been for the last 20 years kind of incrementally defunded and weakened. And we've got a crisis. The irony here is that technology is the only way out, and our nation is the technological powerhouse of the planet. We have more biotechnology resources. We have an excellent healthcare system when it can be engaged. And we had federal agencies that are among the best in the world. the National Institutes of Health, the Centers for Disease Control and Prevention. These are places where some of the best experts in the world, highest density of expertise on the planet. And in fact, before COVID, there was a formal assessment of who's ready to handle a pandemic, and the US came out #1 among the almost 200 nations on the planet. Didn't play out that way though, did it? And the reason that it didn't has nothing to do with whether we have technical resources that are unsurpassed. It has to do with deploying those and applying them to a problem that's emerging quickly. And we'll get into that. But what we have is a situation where fully a quarter of the cases and 1/5 of the deaths are happening in the richest nation on the planet, even though we've only got about 4% of the world's population. So what we have is a catastrophic failure of our system to deploy the technologies and the technological resources. And what we've been doing for the last 9 months is trying to catch up. And now I'll just go into the technical aspects of what does that mean? You've got a new infection that's affecting human beings. That means that human beings have not adjusted to it. There is no immunity to it that's specific to that agent. Now, understand that these cold viruses have been around for a whole long time. Almost everybody listening to this has been infected by a cold virus, including a coronavirus. But this is a variant of that that's much more deadly. What it means is we're going to have to develop ways of stopping the infection from continuing to spread through the human populations. How do you do that? Well, there are several ways to do that. One is you prevent it from infecting people in the first place by physical containment. That is, you stay far enough away from each other, you wear masks, you wear face shields. We know that it infects the body through stuff that's floating around in the air, and then it hits your mouth, or you touch something and then you touch your face. These viruses get into your body through the mucous membranes, usually of the mouth or the nose, or sometimes they get all the way down into the lungs, and that's when we get into very serious problems. So how do you stop that? Well, one is you just make it harder for the bug to get from one person to the other through physical containment, and that's why we have the so-called social distancing, and an especially unfortunate term, since it should be physical distancing and social intimacy, but it's what we settled on. And then the other thing you can do is, when you know somebody's been exposed to somebody else, you ask them. And if you catch it early enough, you can identify the people who have the disease or are potentially spreading it. And then you ask them, who have they been around? And then you go to those people and you say, please go stay in a room by yourself for 14 days until this thing goes away, or we're sure that it's going to go away. And it's very practical. It's detect, isolate, and then make sure that you're decreasing the spread of this germ. So that's one thing that you can do. And some countries did that really well. New Zealand and South Korea and even China did a pretty good job once they just detected that this was a problem. That's a social intervention. The other thing you can do to prevent transmission is to develop a vaccine, and that's the technical fix. That's the American way. And we've got, if you've been following the news, there are 3 trials that are fairly far along. They actually, amazingly, made their protocols for how they're doing the initial tests on these vaccines. The first 3 vaccines that are in the queue out of almost 200. Those protocols for how this is going to be rolled out were made public just this week. And there are a lot of hopes that a vaccine will work. There's also some concern that it won't work because these are coronaviruses. And immunity doesn't last very long for colds. We know that. So we don't know the degree to which this virus is going to be like other coronaviruses. We just don't have those data yet. But that's the other thing you can do to prevent things. But you don't have to be able to prevent things to stop an epidemic. In fact, you can eradicate a disease by having a good treatment. And this is what Egypt has done with hepatitis C. So hepatitis C affects 75 million people, 70 to 75 million people on the planet. So more than 10 times as many people as have been exposed to COVID are walking around with hepatitis C in their bodies. But Egypt is on the verge of eradicating it from its population and there's no vaccine. How do they do that? Well, there are really, really effective treatment drugs that actually stop the virus from replicating in people's bodies. And if you take those drugs, the cure rates are 90, 95% or higher. So there's a lot of activity trying to say, well, can we use some of the drugs that we use on other viruses on this particular virus? And remdesivir was the first out of the gate in terms of treatment, and it's actually aimed at stopping replication of the virus. The other drugs that have been used are more for ameliorating the symptoms long enough that you can keep people alive when they're in the acute phases of the illness, and those are the steroid hormones. So you can treat people, and actually you can get rid of a disease that way if it's a really effective treatment. We don't know if we're going to have that with COVID or not. And then there are other treatments. You take advantage of the fact that some people have survived treatment, have survived infection, and you go to them and you take the antibodies that they have in their blood because they've successfully overcome this virus, and you get rid of the red blood cells and you keep the fluid that has the antibodies in it, and you give that to people who are suffering symptoms, and hope that those antibodies can suppress the virus in that new body. And those are the treatments that was the convalescent plasma treatment that was very hot a couple of weeks ago. And now we're right on the verge of trying monoclonal antibodies, which are actually, somebody has reacted to it. You take an antibody that comes from somebody who's been exposed and successfully suppressed the virus, and you try to identify which antibody is the one that's most effective at suppressing the virus. And you make a whole lot of that using whiz-bang technology, cell fusion, and produce monoclonal antibodies against very specific things on the virus to stop it from killing people and harming them. So that's progressing. We're on the verge of having the first monoclonal antibodies introduced into clinical studies. So we've got all of the things. And then the most amazing failure of the US system is, despite the fact that we've got tons of biotech companies and whiz-bang genomic technology unparalleled, we really screwed up on testing. And why does that matter? It matters because if you don't see it, you can't do anything about it. And you can't see a virus. So what can you do to substitute for that? You have to have a technology that allows you to detect whether that virus is in somebody's body or not. And there are two ways to do that for detection. One is you actually detect the virus, the RNA in this virus itself. And you use that by making lots and lots of copies of the RNA. You turn it into DNA, you stick it into a machine and make lots and lots of copies through polymerase chain reaction. And then you say, hey, was any RNA from this virus in that person's body or not? And that's what you use the swabs for. And that says, is there RNA from that virus in that person's body or on that thing that was on the table or whatever? You're just detecting whether there's nucleic acid from the virus. And that's really sensitive, but it doesn't necessarily mean that that virus is contagious. It means that there's RNA left. The other thing you can do is look for the proteins that are made by the RNA in the process of making an active virus. That's called an antigen test. An antigen is just something that the antibody recognizes. And you're looking for proteins that are carried by the virus, and actually only the virus. And so we've begun to develop really cheap and fast tests for detecting whether the virus is there in sufficient amount that you can actually detect it by putting it in a test tube with these antibodies and seeing if the antibodies stick to the stuff that you've put in the test tube. And if they stick to something, that means there was some virus there. And that's likely to be contagious virus because you wouldn't have the protein unless you had the structure of the virus. It's not completely analogous, but it's pretty close. And it's much more reliable in detecting active virus than the RNA tests. And then finally, you can test people to say, hey, have you been exposed? And what you're really measuring there is the immune system reaction to the virus. And that comes in many flavors, but it comes mainly in the antibodies that we're used to that float around in the blood. Another class of antibodies that are from the mucous membranes that are much harder for vaccines to elicit a response from. But those are the ones that you would really care about because they would stop the infection from the get-go. The ones that would act in the mouth and the eyes and mucous membranes of the body, those are the IgA antibodies. And the final kind of immune reaction is cellular mediated. These are actually cells, white blood cells in your blood that are going to go in and pounce on the cells that are infected by the virus and kill them. So those are T cell reactions. And the vaccines that are being developed are trying to elicit that natural response to an infection, but without having the infection, by imparting parts of the virus. There are many kinds of vaccines that are being developed. And I'll stop there because that's kind of the technical stuff that you need to do, what you need to say. But let's go back to where I started, which is why in the world, with all these technical resources and this warp speed, and it truly has been amazingly fast progress in the science and trying to deploy technologies against this common enemy, why in the world have we seen the patterns of death and destruction that have come out of this pandemic? And one is, most of these are social factors that have to do with how we organize our culture. One is, if people are given a choice between going into isolation and protecting other people as well as themselves, but mainly once you're infected, you're protecting other people when you go into isolation. If you're faced with the choice of, am I going to be able to feed my family, or am I going to go into isolation and nobody's going to pay for my care and I'm not going to see anybody for 14 days, pretty easy to see why people wouldn't go back to work and spread the disease. You need to, when you're doing a serious effort of contact tracing and prevention, suppression, you need to make it really easy for people to do the right thing. And we haven't done that. We also saw incredibly fast and destructive spread in places where there are high clusters of people who are highly vulnerable, like nursing homes, and in close spaces with poor ventilation, where there are lots of people bumping into each other. Things like, bars, frat parties, and things like that. So those are social things. Meatpacking plants are really good for spreading because they're cold and the virus can stay alive for a long time and people are really close together and there's lots of biological stuff to stick to and continue to fester. So all those things have to do with the social dynamics, and I'll stop it at that and turn it over, I guess, to Anna. Is that right?
You'll turn it back over to me, and then
okay.
and then we'll go on to
the last
Kevin.
thing I meant to say, I'm sorry,
That's
Elisa,
okay.
I forgot. I also pulled together this resource page that you very nicely displayed to everybody that I use pretty much on a daily basis now. You know, we're all totally obsessed with what's happening, and what we are following is trying to follow social progress and also social failure of social progress. And these are the sites that I tend to go to time and time again. Some of them are about the cases. Stat News has been doing amazing coverage of what's going on in this space and following the innovation process. New York Times is great. And our own ASU College of Health Solutions, for those of you who are interested in the testing aspects, has got a really, really cool interactive display of what's happening with different tests that are in various stages of development. And you can follow those in real time and figure out which kind of test and who's making it and all that. And then these two hub sites, one of which I suspect Anna will talk about, from the University of Washington, and Johns Hopkins has become world famous for being the place that is providing us with the information that our federal government should have been.
Good, thank you. There are a couple things I want to just bring up and kind of put into a parking lot. And Kat, if you can help me remember when we go back to the Q&A to bring this up.
Sure.
So Bob made the point a few different times that the poor response to COVID, the kind of disastrous crisis that we're in, isn't only because the virus itself is new and is behaving in a kind of a different way and is particularly deadly, but because there was some kind of disconnect between the technological and institutional preparedness that the United States presumably benefited from before the pandemic, and the way things got implemented. And he's attributing that to social issues, social factors, which is appropriate. I want to emphasize that when we see a disconnect like that, this is why I started by framing it with the social ethics and the underpinnings of what we assume we are doing when we are implementing a response through governmental and other means, right? What are the underlying goals and ethical principles that we think that we are adhering to, that we are working toward? Because sometimes when you see a disconnect, it's not just because people are behaving poorly or showing bad judgment or, you know, sometimes there can be more fundamental things at play. And that's an important thing to recognize. Government systems, governance systems are critical things, and making sure that the purposes are lined up between the formal and the informal channels is as important as making sure that we have all of the technological things, from the low tech, as in masks and social distancing, as Bob mentioned, and all the way to the highest tech sorts of medical treatments and vaccines.